So what we wanted to do in our next presentation is actually give you more awareness of what's coming or what's available now in terms of new commercial solutions. And Michelle Harika, who's Principal and Chief Clinical Officer at Equity Healthcare and also an advisor to MIT's Focus Project, is going to be walking us through some new findings. So Michelle, I'll turn it over to you.
Thanks, Jane. So today, what we're going to talk about is new commercial solutions, and specifically, I'll try to point out those that are available to self-insured employers as a result of a project that Jane and I co-led through the work at Focus and MIT. Eric? So today I'm going to very briefly give you an overview of the project so you have an idea of the scope and what we did. I'll highlight some of the key findings, again, pointing out what may be important for you. And then I'll finally wrap up with what I think are some of the implications from what we found. So the project officially kicked off in January, and our goal was to identify actual products or solutions that address the challenges, mainly the financial challenges of gene and cell therapy. It was not intended to evaluate these solutions or to form any kind of opinion. Really, we wanted just to gather information and make it available in a consistent format and then be able to push that out to the public. The way in which we did that was we created what we called a request for information, but basically a survey to gather and assemble the information. And the project team, we worked for at least a month, 6 weeks, really refining those questions and trying to have a set that were not too labor intensive for the respondents, but also provided a good breadth of information. And then we anticipated publishing our results, and I am pleased to announce that our white paper was released yesterday. So many of you may have received that notification. The survey that we used, again, we wanted to be consistent and we wanted to make it easy so that our respondents would give us as much information as they could in a way that was not too hard for them to do, and the output allowed us to kind of assimilate the data easily. So we used a tool from Qualtrics. We ended up with 45 questions, and 45 seems like a lot, but many of them had branching logic, so not all questions were answered depending on how you answered the primary question. We had developed kind of major categories of information. So what is the organization that has the product? How long has it been in existence? The name of the organization, more details around the product itself. When did it launch? A description of the product, the challenges that it might address, what therapies it covered, and who are their customers, and who are their projected customers. We also wanted to understand the impacts to patients and how they might address patient mobility. As Mark alluded to earlier, and Mabe also discussed, patients moving between plans is a challenge. So understanding how each of the products address that would be important. We wanted to understand some of the data gathering and tracking capabilities of these products. Mark alluded to it as well, talking about the needs to be able to, especially in contracts or payment models that have a performance of the product tied to it, really need to be able to track that data throughout the process. We wanted to make sure that there was an internal quality assurance process within the organization, so we asked questions about that. We also asked questions about whether external audits would be allowed for their product and offering. And then finally, one of the other major stakeholders were the physicians or the providers of therapy. And we did want to understand the impact that they may have. A lot of times in solutions and products, especially in the self-insured employer space, a provider and physician abrasion can make or break the success of some of these solutions. So these are the organizations that we surveyed. How did we pick these? Well, we really didn't choose. What we did was our project team, we had 6 or 7 individuals who have been involved with Focus for many, many years, and basically used our own network of what we knew was available in the marketplace. And so we acknowledge that potentially there may be other organizations that have a solution in gene and cell therapy that were not invited to respond. But all of these companies were, and we got 100% of them returned a response. Additionally, we had a couple of follow-up questions just for clarity's sake, and every one of those participated. Now, answers to the questions were not mandatory. So a respondent could have replied that the information we were asking for was confidential or declined to answer. So just keep that in mind as we go through some of the key findings. What we found after we got the results from those 15 or 16 organizations, that we really had 4 buckets of product types. And so I've got them here for you, and I'll give you a little description of each. And I'll try to point out too where they might be important and aligned to some of the payment models that Mark talked about earlier. So the first one is reinsurance. We call it reinsurance stop loss carve out. Basically, it's an additional insurance like stop loss works, but it covers only the costs related to the gene therapy. So like Maeve described, stop loss typically covers all the medical costs of an individual if they've not been lasered in that plan year above some certain deductible or attachment point. It doesn't matter what the treatments are for. With these products, the treatments are defined by the therapy, or the coverage is defined by the therapy or the treatments they provide. The second category was around contract negotiation and data management. And these were products that helped to administer contracts between pharmaceutical manufacturers and the payer. So you and the manufacturer. So think about things like a milestone based contract or something like that. This is where that would fall. The third category was the same type of services, contract negotiations and data management, but it was really focused on contracts between either pharmaceutical companies and providers, the physicians or health systems, or payers and providers or health systems. And this had the added capability, these products, of giving patients access to centers of excellence. So optimizing their ability to be able to obtain these sometimes life-saving treatments. The final bucket was almost like a catch-all, but it kind of worked together. And we called it financial and warranty solutions. So they were solutions that had the warranty, the product was to cover the warranty type payment model, and we'll talk about that in a minute, and or some type of payment plan, simple payment plan. When we look at the respondents and how they fell into those buckets, I have them listed here. So when you look at this chart, the name of the organization is in bold, and the name of the product is in italics. One thing that you will note is that all of the reinsurance or carve out products that you see on the left-hand side of this slide really assume the payer's financial risk, right? When we go to Outcome RX and this specialty therapy warranty product, That's really managing the manufacturer's financial risk for the warranty that they're offering. So this is a product that will kind of administer that warranty payment model. Of these, almost all of them are available to self-insured employers. 5 of the, I think it's 7, 1, 2, 3, 4, 5, 6, 7. Yeah, 5 of the 7 of the reinsurance or carve out are available, and I'll give you the details on which are not. All of the contract administration and data management services, so all 4 of those 2 columns, all are available to self-insured employers. And with the exception of the warranty product, the financial services are available to self-insured employers. One thing to think about, because you may be thinking some of these contracts and entering into a performance-based contract may not be appropriate for a company your size. I do want to point out that Real Endpoints is a little bit different in that it does have a mid-market self-insured employer customer base, and that product does allow for smaller organizations to participate in those types of agreements. Next slide. So I'm going to talk individually about each of those, what I call buckets, and point out some of the key characteristics. For the reinsurance stop loss and the risk carve out, their targeted customers included mainly these 4 groups: the self-insured employers, commercial health plans, and the government plans, Medicare and Medicaid. The 2 that do not include employers as a targeted customer, and I'm going to say this, they responded, their response indicated that they do not include employers as targeted customers. Because I want to be clear, everything I'm saying here is based upon how each of these responded to the survey. The MedShield and PAACT product did not list self-insured employers as a target customer. These are all relatively new, since none of them were available before 2020, so the last 18 months. And for the most part, almost all gene and cell therapies that you've heard about today are covered. Some of them may also include additional therapies that approach that $1 million price tag that are not technically gene or cell therapy. There are no real requirements for patients with these plans other than if they move between plan, there really is, there might be some type of reporting or checking in that a patient may need to do in order to administer these products. So if there's really no movement, then there's no patient or provider requirements. None of these products supplied information that they had a performance-based reimbursement strategy or rebates. And when I'm talking about rebates here, I'm talking about the classic, what we understand as the manufacturer's rebates that you get from the PBM. So the question we asked are rebates that you receive from your TPA, PBM, medical carrier impacted by this product. And all of these organizations replied that there was no impact to rebates. Next slide. When we look at the first set of contract and data tracking services, now remember, this is primarily between the developer or the manufacturer and the payer, so a self-insured employer. They added the manufacturers as potential customers, obviously, because the contract negotiations are between those. And they are relatively new to the market. So late 2020 and early 2021 is when these products became available. Like the other solutions we've talked about, almost all of gene and cell therapies are covered. And one of the products has a possible performance guarantee and does have a kind of a shared savings approach for how they work through their revenue stream and administer their service. Some of these, as you think about developer payer contract negotiation, these products here and the products that we'll talk about next, which are very similar, could be additive to other types of products. So it's conceivable that you might combine, or more likely a very large employer or a manufacturer might combine some of these products together. All of these allowed a customer, so the customer, the one who pays for the product, to audit them and audit results, which was important, especially when we had one of those with a performance guarantee associated. Next slide. The second set is, as you recall, agreements between providers and either a payer or a pharmaceutical manufacturer. And these products are going to manage the administration. So handling the contracting and the data tracking. Because of this, they added stop loss reinsurers to the previously stated customer list. Like Mabe said, right, there may be some reinsurers who may be interested in some type of outcomes-based warranty or something else that they might be interested in, and so this product could be an offering for them. These are the oldest products, but when I say old, 2018 is the oldest, so not really that old, but they have been on the market the longest. Of the products, there's a little differentiation between the coverage of the therapies. One is specific to CAR T therapy. So Jane described those. That's where the therapy is mainly treating people with cancer. So it's an insertion of a gene that helps to bolster the immune system or T cells to fight cancer. The other does cover gene and cell therapies. One of the questions we asked was, do you educate your employers either about the disease, the condition, or the therapy, and do you educate patients or providers of the same? These two respondents did respond that they do provide education to both patients and providers about the gene therapy and the conditions. Now, when you look at the products in the carve-outs, you may recognize some names and understand that they too have educational information that they provide to their membership, but it was not specifically tied to the product we were asking about. So I'll talk about that when I get to the kind of the end and tell you what I'm specifically referring to. If we go to the financial and warranty services, now remember the warranty, that's where you've got the health plan or a payer pays up front and the manufacturer provides a warranty. So if the therapy doesn't work, they will pay for all associated subsequent therapy. Now, the other types of products in this space are really payment plans. So the targeted customers are kind of different for each of the products. The CVS's gene therapy payment plan and August Care's outcomes-based financial solutions are available to self-insured employers. So those are the two of the three that are available. They all cover approved gene and cell therapy. And for the warranty product, manufacturers may actually, when we ask that rebate impact question, the response was that rebates may be amended based, or the strategy on their rebates may be amended based on this coverage. And except for the simple payment plan product, these products have therapy dependent performance guarantees. So when we look at the chart again, and I'll bring it up again, I'll show you which one is just a simple payment plan and the other two that have the performance guarantees associated with it. Before we get to that chart, we asked specifically, and this was also one of our follow-up questions, because we learned that the way in which we asked the question in the survey might not have elicited the response that we thought we were going to get. So we kind of had to ask a validation question. You heard about the risks. Jane talked about them, Mark talked about them, that Focus has identified associated with paying for these types of therapies. There's, or the challenges, not the risks, the challenges associated. They come into 4 areas: risk, cost, administration, and the impact to patients and providers. So we asked each of those, and the definitions are here. I'm not going to go through them all. Mark talked about them pretty well and described them. But the question was, what risks or what challenges does your product address? And that was important for us to be able to understand. So if you go to the next slide, and I don't expect you to be able to read all of this, it's kind of an eye chart. I know that because the font is very small. But the challenges across the top are risk in green, cost is kind of that orange color, administration in blue, patient and provider in red. And just look at the number of dots. So for the most part, the actuarial and financial risk, which is really important to self-insured employers, are covered by almost all of the respondents. Additionally, they're covering the payment timing risk as well. And if we look into the orange column, the cost of the product for almost all of them are covered. The other place that's important for self-insured employers is patient access and how their members may be able to obtain these therapies. And you'll see a lot of dots in that column, which is the second to the last red column. You may go on to the next slide. When we look at the therapies that they cover, almost all of them cover approved gene therapies. Some of them, as you can see in the column on the far right, also cover therapies that might be approaching a high dollar amount, but not technically gene or cell therapy. Fewer, if you go all the way to the left, cover the CAR T or the cell therapies today. However, if you look at the pipeline column, most of them, the majority, indicated that as new drugs are approved from the pipeline, so maybe the 6, 7, 8 that Mark talked about earlier, they would be added to their product and be included in their product offerings. You will not see Evernorth, their Embark product, reflected in this chart, and I'm only mentioning it because it was one of the places where you could choose not to answer the question, and we did not have a response. They responded that this information was confidential, so we don't have them. They're the only one that is not listed on the chart. Next slide. So I said I'd come back to this again. You see those that have the 3-dimensional pop out are available to self-insured employers today. Starting at the far right, CVS Health, that gene therapy payment plan, that is the simple payment plan that I talked about that doesn't have really a performance guarantee tied to it. And that is available today. CVS also has a carve out and stop loss that's reflected on the far left, as does, and I'm pointing these out because some of you may be using these folks today, and you have these available to you should you be interested. Optum RX also has a gene therapy risk protection program, and Evernorth, the Embark product as well. Again, you can see those that are available to self-insured employers. The contract negotiation and data management bundle, those 4 in the middle, may or may not be something that would be appropriate for all self-insured employers, but certainly something to consider. Next slide. So what are the implications from what we found out? We found that there are products available to address the cost of gene and cell therapy. They don't address all the challenges, but we're hearing about new products and offerings that are coming that may address them. Like I said just a few minutes ago, you may already have access to these through your current plan administrator or your PBM. Almost all of those that we talked to did include you as their customer, as a self-insured employer, and some provided even a coverage or their product covered additional therapy outside of gene and cell therapy that is very high cost or approaching, the $1 million point. On the next slide, you have some decisions to make as you consider these products, and the decisions may depend on, and Maeve alluded to this earlier, kind of what is your risk tolerance? What's the size of your company? What's the culture of your company? And or are you in a tight labor market and having coverage for this would be considered, a benefit that employees want? How fast your employees turnover, because if you have high turnover, one of those performance-based long-term contract type products might not be the best for you. Where you are, like Maeve said, what is your stop loss today? Do you currently have stop loss? And what does that current stop loss look like? Mark talked about the toolkit. I'm reinforcing the website here. Paying for cures. I tried this yesterday. If you just put into your Google, if you don't remember the address, paying for cures MIT toolkit, it will pop up. And there's basically a calculator type of function within that toolkit where you can put in your company characteristics and some inputs, and it will help you to identify the likelihood of you being impacted by these therapies, but also maybe what of the payment solutions might be an option for you. I think you've heard today that the landscape that we have, it is evolving, it's complicated, the therapies themselves are complicated, and it's going to require a lot of oversight and potentially management. There are a lot of consultants and brokers on the phone today, and I'm really glad because they can help self-insured employers to be able to monitor that landscape and add value. This is one of the ways where they can add value. It is certainly something that you will have to keep an eye on as therapy and for more prevalent conditions head our way. And with that, Jane, I don't see any questions.
Yeah. Well, so thank you, Michelle. And just a reminder that the white paper that covers everything Michelle has talked about today is available on the Paying for Cures website, not in the toolkit, but just the Paying for Cures website. So if you're interested in that and for some reason you did not receive the notice yesterday, it's available for you there. So Michelle, I have one question for you, and that is, as employers are trying to understand this space that's quickly evolving, how would you suggest that they approach an evaluation of solutions that could help meet their needs?
So without, I have a funny feeling that this is going to come up in our panel as well, but I think the way in which to approach it, the first, if it were me, and advice to self-insured employers that I work with every day, it would be, one, understand what your brokers and consultants are doing in this space and can do for you, right? So understand what they're doing already, because that will identify what gaps and which things you need to do. The second thing would be to contact your stop loss carrier. The alignment of insurance, stop loss carrier, and then their reinsurers is something that I don't think any self-insured employer probably even thinks about, like Maeve said. So I found that to be very compelling from his discussion. So that would be the second thing, the second approach that I would take. Certainly, understanding the leadership of the organization and the fiscal risk tolerance and what the expectations are around budgeting and those types of things will be important, because it will help to let someone know how far they might need to go. Hopefully I've interpreted your question correctly. Is that kind of what you were asking?
Well, it's kind of trying to give you a softball to say what our next steps are with putting some help in the toolkit, but
Okay, so here we go. So I was almost going to say it and I thought, well, maybe I'm not. So and it leads to the question that came across as well. Are we planning to keep this list up to date with new entrants, experiences, and cost comparisons? We did not get any cost information from any of these organizations, so I'll say that up front. And what we decided to do was, and it was based on feedback at our last design lab, rather than try to keep this list up to date, what we're going to add to the toolkit, Jane, I think is where you're going,
yes, thank you.
are the key considerations that a employer or a payer or purchaser would need. What are the key questions that they need to ask the suppliers of these solutions? And the key questions that they would need to think about in order to evaluate whether or not they should purchase one of these products. So rather than try to keep this list up to date and have that continued maintenance, we thought a better option would be to really have a tool that allowed payers to really have a kind of a checklist of what they need to ask as they go out and shop.
Great. So thank you so much, Michelle, for putting that together and focusing on the implications for employers. Really appreciate that.